The health authority says the city typically sees an increase in respiratory illness. Raywat Deonandan is an epidemiologist and associate professor at the University of Ottawa. Hi there, thanks for being here.
It's my pleasure. Thanks for having me again.
What kind of illnesses can we expect to see circulating more often as we head back into the school year?
Well, of course, COVID is the big one, and we're looking at a big COVID wave starting right now. It's not quite RSV season yet. That's later in the fall. There is a little bit of flu floating around in Ottawa right now. The cases are elevated according to wastewater data. And of course, we have allergies that are always fun, and the common cold is never far away.
Yeah, do you have much concern about whooping cough?
Well, yes. Whooping cough is cyclical, so every 2, 4, 6, 10 years you see an increase in cases, and it looks like we're seeing one now. That might be due to the cyclicality of this disease, or it might be due to something else. It's unclear. But yes, it is a dangerous disease, and we should not take it lightly. If your child is due for a booster shot, make sure they get it.
Yeah, I want to talk a little bit about vaccinations because OPH also reminding people that children who received an oral polio vaccine since April 2016 no longer meet sort of these provincial vaccine requirements for school and daycare. So just remind us if families are facing barriers, let's say, to getting their children vaccinated for various things, where can they turn?
Of course, you seek your primary healthcare provider first. A lot of people don't have primary healthcare providers, unfortunately. As a result, Ottawa Public Health is offering community vaccine clinics for any child with a due vaccine. So if you've got an Ontario Health Card, just check the Ottawa Public Health website for a clinic near you.
Okay. And when it comes to COVID, levels have been high for most of the year. Are you expecting that to increase as we head into the fall?
Absolutely. Looking at the US situation, they're looking at enormous waves. We have a situation in Tennessee and Alabama where schools were closed again temporarily for an increase in COVID cases. We see about 16% of ER cases, sorry, 16%, 6% rather, of ER cases in those states due to COVID. And these new flirt variants, as we call them, are really evading the prior immunity that we got from prior infection and vaccination. And that's what's driving this new wave. So when the new vaccine booster comes available, I hope everyone goes and gets it because it's a close match to the circulating strain. And that's always a better bet for preventing actual infection and definitely preventing hospitalization and worse things.
Yeah, and I mean, aside from vaccination, just remind us some of the other ways that parents can protect their children and people can just protect themselves, as we head
Yeah.
into.
Hand washing is popular. Hand washing is great for the common cold and flu. It's not as effective for COVID, which is mostly airborne. But wash your hands absolutely to prevent a variety of infections. If your child goes to the playground, make sure they wash their hands when they come home. Mine absolutely does. Mask wearing is, of course, perfectly effective. Not perfectly, but very effective. It's just fallen out of fashion in the past few months. So if you're concerned, wear a mask. If you're in a crowded indoor setting like transit, I would definitely wear a mask. Ventilation is absolutely key. And I wish policymakers would take ventilation more seriously. Getting a HEPA filter, opening a window, that sort of thing really does well to reduce the probability of infection for a variety of diseases, not just COVID. And what I hope parents really take to heart is if your child is showing symptoms of a respiratory illness, keep them home if you can. There's no need to infect other people if you can avoid it. I think that small action, writ large in a large population, will pay massive dividends.
Yeah, I mean, I know lots of parents, including myself, are thinking, okay, here we go again. Everyone's going to get sick. So I'm wondering if you can just talk about some things that people can do in the home to prevent the spread of illness among family members.
Well, if your child is showing a respiratory illness, again, when you touch them or share food, wash your hands in between. Try not to share utensils. It's hard when my child is sick and he sneezes in my face or kisses me. I'm not going to push him away. It's hard.
Mhm.
But in general, you can seek to minimize that kind of intense contact or make sure you wash surfaces in between. Again, that works great for the flu and the common cold and things like that, diarrheal diseases. For COVID, keep those windows open. That helps a lot. Get up
Keep
to
those
date.
windows open.
Yeah, absolutely. And be update on your boosters, especially the COVID boosters. It really does work remarkably well, as we see from the population data.
Now, after the pandemic, there was sort of, a lot of talk about immunity and how children and people in general weren't exposed to as many viruses for a couple of years, and so they were catching more. when things did reopen. So I'm wondering if that immunity is building back up, and if there's any hope that maybe this fall will be a little better for parents and others.
Yeah. It's a
In terms of
controversial
illnesses.
theory. It's called the immunity debt theory. It's controversial. There are, arguments pro and con, whether it's real. Definitely, a lot of kids missed their scheduled vaccinations during the COVID lockdown, and we're seeing manifestations of the impact of that now. Whether or not lack of exposure to infections has led to an increase in cases now, that's more controversial. If that's the case, we should see a lesser wave of things like RSV this year. I hope that's the case. We'll wait and see. In any case, when the RSV season begins in late fall, and so forth, I think we should take every precaution we can to make sure that we curtail that spread, because RSV is never fun. So if you're a senior, get your RSV vaccine if you qualify. It does cost money out of pocket, unfortunately, but the effectiveness is quite high.
Okay, we'll leave it there. Thank you so much for your time.
It's my pleasure. Thank you.
Raywat Deonandan is an epidemiologist and associate professor at the University of Ottawa. Excellent. Thank you so much. I appreciate it.
Is that good? Okay.
Okay, yes. Take care.
Bye.